Okay guys, Timmy coming at you again. Alright, and today what I'm going to go over is magnesium and how magnesium affects your body. First of all, a couple of things. Magnesium is primarily intracellular, inside the cell. And the normal blood levels are 1.2 to 2.6 milliequivalents per liter. Right? A couple of things you need to know. Remember that enzymes control all the chemical reactions inside the cells of your body. So magnesium is required to regulate those enzymes of metabolism. So magnesium actually alters the shape of enzymes, and what can happen is if your magnesium is too high, enzymes slow down, or if it's too low, they slow down. The other thing is magnesium is needed for the sodium-potassium pump to work, and we learned about that, right? It's ATP dependent, and it shoves 2 potassiums into the cell and throws 3 sodiums that were in the cell back into the blood. So it regulates potassium leaving the cell, and this is important. Probably the most important thing, I'm going to draw a star. See, look at that. Magnesium blocks calcium channels. I'm going to say that again. Magnesium blocks calcium channels. And where do you find calcium channels? In the cell membrane. You find it in the heart, blood vessels, arteries. Right? And you find it in smooth muscle. So uterus, bladder, places like that. Alright? And again, I'm clearing my throat to make sure that I say this really clearly because it's important. The most important element in muscular contraction is calcium. And the heart, blood vessels, and smooth muscle parts of the body like the uterus rely on calcium from the blood to contract. So if magnesium blocks calcium channels, it's going to affect the heart, the blood vessels, and smooth muscle parts of the body like the uterus. Yeah. Alright. Causes. The biggest one is renal failure. Right? One of the things that happens in the kidney is magnesium is filtered into the collecting tubules and then it's reabsorbed back into the blood. In renal failure, what happens is potassium is exchanged for magnesium. So magnesium gets brought back into the blood in exchange for potassium, and your potassium level goes up. Also, a lot of laxatives and antacids contain magnesium. Magnesium citrate, magnesium carbonate, milk of magnesia. So continually taking those can elevate your blood levels of magnesium. And magnesium is given for a couple of things. One of the things you're going to have to know about is magnesium sulfate, or mag-sulf, right? Mag-sulfate. Yeah. That's given for toxemia pregnancy. So you probably heard of eclampsia or preeclampsia. And one of the things that happens in preeclampsia and eclampsia is you get this really huge increase in blood pressure. And this high blood pressure can do damage to the placenta, and that can do damage to the fetus. Also, if a woman's going into premature labor, the uterus is contracting, and because the uterus is made of smooth muscle, you give them magnesium sulfate, because what does magnesium sulfate do? It blocks calcium channels. And what's the most important element in muscular contraction? Calcium. So let's go back. Because magnesium blocks calcium channels, where do you require calcium? You require calcium for the uterus to contract. Now, if a woman is going into premature labor, you don't want that uterus to contract. So by giving them magnesium sulfate, it prevents the uterus from contracting and controls that premature labor. All right? Now again, if your blood levels of magnesium are high and blood levels of magnesium blocks calcium channels. Where do you find calcium channels? In your heart, blood vessels, right? So, watch it. High levels of magnesium in the blood are going to cause arteries that were this big to now become this big. It causes arterial vasodilation. So, if your arteries drop, right, if the diameter of the artery gets bigger, then the resistance to blood flow drops, and that drops your systolic blood pressure. So one of the side effects of administering magnesium sulfate is low blood pressure. Also, the arteries that line your skull will dilate. So that means more blood is going to be going to those arteries in the skull. And one of the side effects of high magnesium is a pounding headache. The other thing is it can lead to heart failure, right? Because high levels of magnesium, the most important element in muscular contraction is calcium, and the heart and blood vessels rely on calcium from the blood to contract. And high magnesium blocks calcium channels. So that will decrease the force of contraction of the heart, and it can actually lead to heart failure. Alright. Now, when we talk about the heart, alright, you're going to get a drop in heart rate, and you're going to get a decrease in the force of contraction of the heart, or how hard that heart contracts, and that's going to lead to a drop in systolic blood pressure. So these people can develop hypotension, right? And magnesium blocks the release of neurotransmitters. So less neurons are going to be firing in your brain. That's going to lead to confusion. So yeah, muscle weakness. They're going to become lethargic. And if it's bad enough to go into a coma, their reflexes become very, very low. Alright? Now, let's look at the arteries. Now watch. This is kind of a mess, but bear with me. In order for calcium from the blood, so this is the lumen of the artery, this is where the blood is flowing in the artery, and this is the muscular wall of the artery. In order for that muscular wall to contract and make that artery diameter smaller, vasoconstriction, calcium from the blood has to go through a specific calcium ion channel. And when it does that, it's going to cause the arterial diameter to get smaller because the muscular wall will contract, vasoconstriction. What does magnesium do? Magnesium blocks calcium channels. So the artery will not be able to contract, so it will dilate. So all of the arteries will dilate. These people will be, their blood pressure will become low, their skin will become warm and red, and that could be bad for you. So what do? Right? The number one cause of high magnesium is renal failure, so you got to treat the renal failure. Dialysis, right? And then you have to protect the heart, right? The heart's not contracting so good. So what does magnesium do? It blocks calcium channels. So you give them IV calcium, and that will, the more calcium you end up in the blood, the more it will overcome that elevated magnesium. And again, the most important element in muscular contraction is calcium. So the more calcium that's available to the heart, the harder it will contract. and the blood vessels will constrict, raising your blood pressure. All right. So that is high levels of magnesium, or hypermagnesemia. Now, I'm willing to give someone extra credit if they're willing to legally change their name to hypermagnesemia. You can email me and let me know, but I'll need to see official documentation. All right. Okay. Low magnesium. There you go. Causes starvation. Now, one of the things that could happen to you guys during the semester, because you'll be studying so much, is that you won't eat and you'll starve. And as a result, you could develop low magnesium. You need to watch that. So have like a bowl of Fruity Pebbles or a Rice Krispie treat before you study. Now, alcoholism too. Alcohol is a natural diuretic because it inhibits the effects of ADH in the kidney. And the more urine you produce, the more magnesium you excrete. And vomiting and diarrhea, look, that's where you get your electrolytes from, the food that you eat, right? So if you can't keep that food in and get it absorbed into the blood, then you're going to have problems with all electrolytes, not just magnesium. So vomiting and diarrhea. And then metabolic acidosis. In a metabolic acidosis, the kidneys will excrete more magnesium along with more hydrogen ions. So the lower the pH of the blood, the more magnesium you lose. And loop diuretics like Lasix, high levels of Lasix, because you're going to get rid of sodium, potassium, chloride. You will also get rid of magnesium. So excessive use of loop diuretics, especially loop diuretics, Lasix, will cause your magnesium to drop. All right, so let's look at some of the signs and symptoms, Again, because magnesium blocks calcium channels, and low magnesium is going to make calcium want to flow in to the heart and blood vessels more frequently. Oh, this is very important too. Watch it. Low magnesium makes sodium leak and voltage gated channels leakier. So if more sodium leaks into a nerve, like we've been talking about, it will increase the firing of that nerve. So they will develop tremors, seizures. That's why magnesium sulfate is given as a treatment for seizures. So if you give them Valium or Dilantin and that doesn't work, then they will give them magnesium sulfate. And if you recall too, magnesium blocks calcium channels. And in order for a nerve, so this is the end of the nerve, in order for a nerve to release neurotransmitter, at the end of the nerve, that's a bad color. Is that better? Yeah. At the end of the nerve, there are little calcium channels, right? So if magnesium is low, calcium enters more frequently and releases more neurotransmitter. And that neurotransmitter, because more is being released, that central nervous system becomes much more active. And again, the highest level of neural activity you can have without dying are seizures. Now, what can happen if your magnesium level is low? You can develop hypertension, right? Because if your magnesium level is low, then more calcium is going to enter the heart and the blood vessels. So the arteries are going to vasoconstrict. That's going to increase your blood pressure. And the force of contraction of the heart is going to go up, right? So your heart rate's going to be higher. And the heart becomes more irritable when your magnesium is low, just like the nervous system becomes more irritable. And you get this kind of unique ventricular tachycardia called torsade de pointes, or what's called twisting of the points. So this is ventricular tachycardia, and it looks like it's twisted, like somebody just turned the EKG upside down. And this is a classic sign of low magnesium. And you're not going to believe the treatment for torsade de pointes. Yup, you got it. It's magnesium sulfate. Right? So, what do we want to take away from this? Number one, if you remember that magnesium is a natural calcium channel blocker, and if you also recall that the heart, the blood vessels, the arteries, and smooth muscle parts of the body, like the uterus, rely on calcium from the blood to contract, then you're going to know what happens in hypo and hypermagnesemia, right? Also remember torsade de pointes, twisting of the points, and that's usually seen in low magnesium, and the treatment is magnesium sulfate. Here's another thing. Low magnesium is usually associated with hypokalemia and hypocalcemia. So if you remember what hypokalemia and hypocalcemia do to nerves, then you're going to know, and you should recall, that it increases neural activation, right? The nervous system becomes more active, right? So you're going to get tremors, you're going to get that carpal pedal spasm, torsade de pointes, right? You're going to get tetany, seizures, right? Muscle weakness and tetany because you can't relax the muscle. And the treatment is to give them magnesium IV if it's severe. Otherwise, you take magnesium supplements orally. Now, a couple of things. Because hypokalemia goes along with hypomagnesemia, one of the things you have to remember is you have to correct the potassium first. Because if the potassium is low, the magnesium will continue to stay low. So if your potassium is low in the blood, along with your magnesium level, then the kidney will continue to excrete the magnesium. So you have to correct the hypokalemia and then administer the magnesium. Very important that you remember that. Alright, I hope that helped. My dishwasher just went on.